Isn't he? Meanwhile, the road to the Olympics is over for Lindsay Vonn. In a Facebook post today, the Olympic downhill skiing champion says she won't be competing in Sochi next month. Vonn says her knee is too unstable to compete at the Olympic level. She injured her knee at the World Championships 11 months ago. After that, the four-time World Cup overall champion underwent reconstructive surgery. She was recovering, but a crash during training in November aggravated the problem. Orthopedic Specialty Hospital in Murray treats patients with similar knee injuries and helps them return to their respective sports. Joining me now with one of those experts is Dr. Roy Trawick. Thanks for being here, Doctor.
Thank you. Thanks for having me.
We're glad to have you on the show today. I wanted to ask you, what type of injury does Lindsay have specifically?
Well, she had her ACL reconstructed back in February by Bill Sterrett out in Vail. And he's an excellent surgeon. I'm sure everything had gone very well. She initially re-injured her ACL. They publicized it as a stretch to her graft. To me, that means she popped the graft and was just trying to gut it out and be ready for the Olympics. Certainly, it's the biggest stage for an American skier. She wants another good showing at the Olympics. But the kicker was when she also injured her MCL later, her medial collateral ligament, which is on the inside part of the knee. And what that does is translate that ACL deficient knee into one with a combined ligament instability.
So her knees are really messed up.
Absolutely. Well, at least, you know, for the time being. I mean, this is a very solvable situation, but for her to be able to compete, as she said, at an Olympic level and to her satisfaction, I'm sure her professional pride would not allow her to go and have a mediocre or poor showing. And so I think she probably made a very wise decision to back off, get the problem solved, and come back on the World Cup stage later.
Now, obviously, you don't treat Lindsay Vonn, but you treat people with similar knee issues. How easy is it for someone to re-injure their knee like she did?
Well, it's very easy. I mean, people tear their native ACLs, and certainly the graft is, we don't want people to return to sport of any type until their graft is well healed, but on top of that, they need to be functionally healed, and that's beyond the biology of having a graft heal into the knee. It has to do with muscle strength, endurance, coordination, so that the person has control of the knee, so that their risk of re-injury is lower. And that's the big thing that we do at TOSH is not only, I mean, the surgery's tip of the iceberg. Most of the meat and potatoes of getting somebody back to their chosen sport happens after I touch them. It's more on the rehab side of things.
So how do people know that they're ready to come back from an injury like that?
Well, you know, our program, I mean, we have a very systematic approach to this. I mean, in a sense, in the early phase after the surgery, you can't fool Mother Nature. You have to give things a chance to heal. But then there are certain levels of functional assessment we have as a patient goes through the rehab process. Certain little tests that people have to be able to pass before we let them go to the next phase.
And that's what you would imagine.
Yeah.
But obviously, you have people out here, not our viewing audience isn't a bunch of professional skiers. We have some of them, but most of them are recreational skiers. How at risk are recreational skiers for the same type of injury?
Well, a lot of that depends on what kind of skiing they're trying to do. A lot of people are trying to prove what kind of black runs they can go down, and they may not be the best. I mean,
sometimes they're trying to prove it to the wrong person.
That's exactly right. You know, a big thing, too, has to do with their preseason conditioning. You know, somebody who's out of shape and goes and hits the slopes at 100 miles an hour is not going to do particularly well. Strangely enough, a lot of the injuries that we see happen on the green slopes right in front of the lodge. You know, somebody's gone and done some difficult run. They get down close to the lodge. They have a lapse in concentration, cross their tips, and there they go.
That's all it takes?
That's all it takes.
Wow. Well, there you go. So be careful is the message,
That's
regardless of what you're doing.
Absolutely.
There you go. Dr. Roy Trawick with the Orthopedic Specialty Hospital. Orthopedic Specialty Hospital. We'll say that 3 times fast. Nadia, can you say that 3 times fast?